So there are some basic elements of a typical week for a fellow that will always be the same, beginning with our 3 regular staff meetings during the week. So Mondays, Wednesdays, and Fridays, we always have a 1-hour staff meeting, which is multidisciplinary with different guilds represented and present, those people who work directly with the patients. On Mondays and Fridays, it's a chance to kind of start and end the week to hear about what's going on with our patients and our work together to kind of hold in mind the people that we are engaged in the psychoanalytic process with. And on Wednesdays, that meeting is an open meeting to think more associatively about what is going on in the system and how to think dynamically about what's happening in our group as a staff and the group of patients and what we might learn about each group in relation to one another. Fellows also participate twice a week in case conferences, which are held for 2 hours on Tuesdays and Fridays, which are an opportunity to hear about close process of one case that's usually in the first 6-week treatment evaluation phase, although sometimes they're representations of cases that have been going on for a year or more. Fellows also have a weekly didactic seminar that they attend on Tuesday evenings. And depending on where you're at in the fellowship training process, you might attend a weekly continuous case seminar to just look at close process of one psychotherapy. If you're a psychologist, you would be attending psych testing seminar for 2 hours weekly on Thursdays, where you learn about projective testing and cognitive assessment and learn how to write a really kind of unique sort of report in relation to specific questions from the therapist about the case that they're working. If you're a psychiatrist, you would meet weekly for the psychopharmacology group, which is a place to integrate a psychodynamic, psychopharmacological approach to our work with our patients and to think deeply about that. In addition, there is all of the casework that then would be happening. So our fellows typically are carrying about 15 hours of clinical work or related contact. So if you think about 3 patients that you're seeing 4 times a week, that's 12 hours. And in addition, every case has 1 hour of individual supervision assigned. And that's consistent throughout the course of the fellowship, all 4 years. Fellows have the opportunity to choose their supervisors based on relevant areas of kind of expertise or interest, and so it's a wonderful chance to shape your learning here at Riggs. In addition, depending on where you're at in the fellowship, you'll be in some process of consulting to groups or some level of involvement in the therapeutic community program. So that would usually be a couple hours of the actual group consultation and then an hour of supervision of the groups. And so as I'm talking, you can see that even though the number of patients you see is fairly small, the schedule gets very full very quickly, in part because of the many learning opportunities that are just embedded throughout every day. Later on in the fellowship, there's an opportunity to carve out some space to specialize in an area of interest. So whether it's research and writing, teaching and supervision, further consultation to groups, human development, or we encourage fellows as they're working here, if there's something they're particularly interested in, to work with us to develop a way to support their ongoing learning and time. So that's typically what a work week would look like. Outside of the general work hours, which are 8:30 to 5 every day, fellows sometimes will have on-call responsibilities. And although those are less frequent than in most hospital settings, it is something that is part of the training here to learn how to respond to emergent issues or crises after hours.
The only things I would add in terms of just the regular weekly structure, fellows would also participate in 2 team meetings a week, 2 one-hour team meetings, which are really a place where you can wrap your mind around a smaller number of patients. So as a community, we're wrapping our minds around the whole patient community of 50 to 60 patients. The team meetings would tend to have 12 to 15 patients, so you have a much better opportunity to really get into those specific treatments, thinking not just about the psychotherapy, but also the integration of the different modalities, paying attention to things like systems enactments that emerge in the treatments of those patients. And so really learning to toggle back and forth between thinking about those patients on an individual level and thinking about those patients in their treatment context.